Welcome to The Smart Life. I'm Derek Lata.
And I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios. You know, we talk about exercise so much on this show, right?
That's correct.
We talk about the recommendations, but what happens when you don't hit the mark? Maybe you do too much, or maybe you're doing too little.
Well, here to talk about the impact on your body is Dr. Omar Issa of Coral Gables Cardiology Associates. He is board certified in internal medicine and cardiology. Welcome to Smart Life, Doctor.
Thank you very much for having me. It's a pleasure to be here.
Great to have you. We're always curious of how our doctors, how they got interested in their field of expertise. For example, how did you get interested in cardiology and exercise, for example?
Well, I think I first became interested in cardiology probably around medical school when I first saw the numbers that heart disease really is the #1 killer, particularly coronary heart disease in the world. And then even looking down the list, stroke is number 3. And so I think it's mainly the impact. You know, you get to reach so many people. There's so many people with this problem. And then my focus on exercise and sports, I've really been interested in my whole life. And so being able to combine these two as a sports cardiologist and make people, keep people healthy, and then in addition to that, allow them to reach their performance goals, it's a perfect match for me.
And I love the fact that you have internal medicine and cardiology, because most of the time you have to go see 2 different doctors to get that 1-2 punch, let's just say. Yeah. So with you, we actually get like 2 birds with 1. In other words, it's fantastic.
Exactly.
You can actually give us so much more information and the patient more education.
Absolutely, and I think that the heart plays into a lot of the other systems of the body, and so it's nice to have that knowledge of both with your doctor,
it's really
treating
great.
you.
You know, not only did you study that, but you're in great shape. I'm sure you were an athlete when you were younger. What are the benefits of exercise? I mean, I know
we
people say it,
2 hours
but
now.
give us the major benefits of exercise.
Well, we can talk about a lot of different benefits of exercise, but exercise gives you the benefit, which is it keeps you alive longer. If you can just get off the couch and do a little bit of activity consistently, at any age, really. So it's not too late to start at any time, but you can reduce the risk of dying of a heart attack pretty much in half, and our studies have shown that it adds a couple years to your life.
It really does. And I love to actually change the word from exercise to kind of just like movement, because a lot of people say, I don't want to exercise, but just move, right?
Correct.
Just get out there and do something.
Correct.
Exactly.
Now, recommendations. We were talking about that earlier. Sometimes too much, too little. What are the recommendations you give your patients in terms of, what do I do, doc, every week?
Sure. Well, this really comes from a document that came about in 2008, which is the Physical Activity Guidelines, and they're endorsed by the American Heart Association, the American College of Cardiology, and the recommendation really is for 150 at minimum to 300 minutes of moderate intensity exercise a week.
Okay, so that's 2.5 hours, if you will, right?
Yeah, I mean, it's
About 2.5
essentially
hours.
it needs to be, they like it to be broken down into a couple sessions. So something in the range of 30 minutes, 5 times a week.
Okay,
on
perfect.
average. And a lot of people ask, what's moderate intensity exercise? Because that's usually the next question. And that's really any exertion that increases your heart rate, increases your respiratory rate or your breathing rate, but that you can carry on a normal conversation without getting short of breath. And so that ends up being something like a brisk walk at 4 miles an hour, or cycling at about 10 miles an hour. But this could be different for everyone.
Different for everyone. For us, the average, what you said kind of fits in. How about people like ultra marathon runners? They're out there, they run every day 4 or 5 hours. Bicyclists, are they harming their body by all that exercise?
Well,
is that too much?
It's a complicated answer to that question, really. These guidelines, this 150 to 300 minutes, it comes from a lot of data, a lot of studies that were done before 2008. And what those showed is that kind of range gives you the best bang for your buck in terms of benefit. So beyond 300 minutes a week, you still see some benefit, but the incremental increase in benefit starts to kind of decrease. And then, over the last several years, we've seen a huge uptick in marathoners and these ultra endurance races, triathletes, and so we became concerned. Is this too much exercise, right? And initially there were some reports that this may be kind of a U-shaped curve with the benefit, where the benefit kind of falls off and even becomes a detriment. But more recently, we've done some large population-based studies that show that up to 10 times that recommendation. So we're talking about couple hours a day of exercise, the benefits start to kind of level off a little bit, and maybe there's a little decrease in the actual benefit, but it never gets back to the level of just being inactive. And so the recommendation is to do as much exercise as that challenges you and keeps you happy, because there is no downside to it. You just may not have the same benefit that you see at that kind of normal range.
Right. Well, no downside if you're not one of those marathon runners that drops dead of a heart attack or something
Oh my
like that,
goodness.
because
Well,
it
that's not-
happens. But
and
anyway,
that's rare.
Yeah, but hold on, let me finish. Those 150 to 300 minutes, how should you divide that? Because you need some weight resistance as well as cardio. How do you, is there 50-50 division of that time that you
The
recommend?
recommendation is strictly for aerobic exercise. So
Aerobic.
that's the cardio part. And if you dive deeper into that document, it does recommend a few sessions of some isometric exercises, some weight training. But a lot of the benefit is really in that aerobic activity. Okay. And you mentioned that every once in a while someone drops dead in these marathons. This is a very rare occurrence, I want to say, somewhere in the range of one every 200,000 marathon participants.
I mean, it's really rare. But it makes sense, because the heart is a muscle, right? And it's just like, when you strain your muscles or you pull a muscle, you can't push the heart, I think, so much. But again, I think it depends on the individual. What is it about the exercise that's actually helping the heart? It makes sense to me.
question.
I'm assuming it makes the heart stronger, and it makes the blood maybe move better. But you fill in the blanks.
I will fill in the blanks for you here. So a lot of the benefit, we've looked at this, that comes from exercise, really it comes from the improvement of cardiovascular risk factors. So when you exercise, it decreases your blood pressure. When you exercise, it's going to decrease your weight, it's going to help your cholesterol, it will decrease your blood sugars, improve blood flow. All of these things are known to be risk factors for heart disease. A new area of research has shown, probably this is one of the most interesting things here, is that exercise acts as an anti-aging. And so age is actually a risk factor for cardiac disease. Our muscles, as we get older, create a lot of inflammation. In addition to that, we have a lot of this oxidative waste product. And with exercise, we can actually reverse this process. Okay. And these things tend to actually get into the heart muscle and blood vessels and damage them. And so exercise actually reverses a lot of these processes that occur with aging.
And you really feel it after you start exercising, and again, moving at any age, starting at any time, because you kind of feel like that, but the recovery, when you start recovering, you realize you recover quicker, then you're really getting into shape, which is great.
You feel good.
Right.
You feel good about yourself. Yeah, absolutely.
Doctor, I've read that there may be a link between endurance athletes and calcium scores. Can you tell us anything about that?
Sure. That's actually a very kind of controversial topic in this sports cardiology realm. And let me just break down what a coronary artery calcium score is for those that don't know. This was a test that was invented by a cardiologist and is used to predict risk of a heart attack. And it's a low radiation dose CT scan, and we look for calcium in the arteries of the heart. And where there's calcium, there tends to be blockages, and where there's blockages, there's this higher risk for a heart attack. And so it's a very predictive test. Okay. Recently, we started looking at comparing athletes to non-athletes, and we're finding a lot more calcium in the heart arteries of athletes. But they kind of go against the traditional wisdom in that despite having this calcium there, they're not at increased risk. We're not seeing more heart attacks. So, the jury's still out on this. We haven't really gotten to an answer as to what the significance of it is. A lot of the leading experts feel that in athletes, the process is a little different. This calcium is actually protective, and that it stabilizes these plaques that we see.
Okay.
So that's a great reason to bring you back another day, because you're fantastic, and talk more about calcium scores and things of that nature.
Absolutely.
Thank you so much.
I'm
Just a
happy
reminder
to.
of viewers also, if they are starting an exercise program, always consult with your physician first.
Correct.
Absolutely, because there is a small risk for people that just when you start an exercise program like that, people actually end up having heart attacks sometimes. In fact, you hear the common story of someone who's shoveling snow and has a heart. Maybe shoveling snow is more of a Boston issue and less of a Miami issue, I would say.
Because you are from Boston, I know.
Right. But people do have heart attacks. It's a low risk. The people that tend to have these heart attacks with exertion are people that have been sedentary their whole lives and then try to do something strenuous.
Right. So always consult with your doctor.
Always consult with your doctor. Yeah. And not just if you're sedentary. If you're going to make a change from, say, running a mile or two a week to, I'm going to start running marathons now, that's another person.
Make sure you can do it.
Absolutely.
Exactly.
Great stuff.
Exactly.
Great
Thank you so
information,
much,
doctor. Thank you. Thank you for being on the Smart Life.
It's my pleasure.
You have a question? We've got the answers. Stay tuned for our Ask the Experts segment.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at All Health TV on Facebook, Instagram, and Twitter.